Introducing a revolutionary new device and technique for upper eyelid surgery. My financial disclosure is that I am the inventor of the Ziplyft and founder of Osheru, the company that makes Ziplyft. I have been an eye surgeon for the past 25 years and I've done thousands of blepharoplasty procedures. Upper eyelid blepharoplasty is the second most common cosmetic surgery done in the U.S., with over 500,000 procedures performed annually and over 2 million worldwide. With the pandemic and Zoom calls, the number of these procedures has increased, and by 2026, the eyelid surgery market is projected to be $5.2 billion. Traditional blepharoplasty has several limiting factors. It is time-intensive, taking up to 60 minutes. It requires an experienced surgeon, and it is invasive, involving cautery and suturing, and the patient can have up to 2 weeks of downtime. There can also be complications, including significant upper and lower lid bruising, wound dehiscence, and there can be unacceptable asymmetry. My innovation insight came when I was at an ancient Egyptian medicine exhibit. The Egyptians removed excess eyelid skin by compressing it between two small twigs, depriving it of blood supply, and the excess skin would fall off within 5 days. Inspired by this idea, I designed the Ziplyft device. The Ziplyft device and technique is the first minimally invasive surgery for upper eyelid excess skin removal. The Ziplyft has many unique design features. There's a guarded blade that slides across to excise the skin. There are serrated jaws that compress and seal the unwanted skin, eliminating the need for cautery. And the device has a clear design, so the surgeon can see the markings on the skin to be removed. There is a locking mechanism to secure the skin, and there are markings on the device to improve symmetry. The lower jaw is placed along the patient's marked natural lid crease, and the forceps are used to pull all marked tissue into the jaw opening before closing and locking it. The device is closed and locked, trapping the unwanted skin so there is no bleeding and no need for cautery. The second device is placed on the fellow lid symmetrically and locked into place. The guarded blade glides across to excise the unwanted skin. Once the skin is removed, the device can be unlocked and removed, leaving a smooth ridge of skin along the incision. Tissue adhesive is applied to both eyelid incisions and left to dry for 1 minute. The patient can open and close their eyelids easily with the glue in place in the immediate postoperative period. The patient has symmetric incisions that are sealed with tissue adhesive. Postoperatively, the patient has some swelling, but no bruising above or below the incision. This patient is a 51-year-old white female with excess unwanted eyelid skin, and here she is postoperatively day 9. She has no bruising above or below the incision, and the incision is well healed with the glue dissolved at 7 days. The Ziplyft device has jaws that open and close with the lever and a guarded blade that tracks along the jaws to excise the unwanted skin. Here's the patient marked for blepharoplasty. The brow is marked as well. Here we have a patient where we're starting the procedure. We put the lower jaws up against the natural lid crease and then pull the excess unwanted eyelid skin into the jaws of the device, making sure all marked tissue is within the jaws before we close and lock the jaws in place. The locked jaws eliminate the need for cautery. The second device is placed on the other eyelid, again making sure that the lower jaw is along the marked natural lid crease and that we pull all unwanted excess eyelid skin up into the jaws before we close and lock it. We are checking the markings on right and left upper lids to make sure that both are in the right position and that we have all the excess tissue in the jaws before we close and lock. We are using the guarded blade to swing it across and excise the trapped eyelid skin tissue. This removes an ellipse of tissue from the upper eyelid. We are now removing the excess eyelid tissue from the left upper lid. We dry the tissue off and then we unlock and remove the device, leaving a ridge of sealed skin. And we can apply the tissue adhesive across the incision, allowing it to dry for 1 minute. Similarly, on the left eye, we remove the device, leaving a ridge of sealed tissue that can be closed with tissue adhesive. The benefits to the surgeon include that they get consistent and symmetric results, there's reduced operative time, and the procedure can be completed in less than 10 minutes. It can be done without IV sedation, and there is no need for cautery or suturing. The benefits to the patient include reduced downtime, little bruising postoperatively, and no need for suture removal. The patient has a more youthful appearance and improved peripheral vision. Early clinical results are promising. We have completed 8 patients with the Ziplyft device, and we have successfully reduced bleeding, eliminating the need for cautery, and demonstrated successful wound closure with the adhesive, eliminating suturing. We have consistent, symmetric results, and the surgery can be done in less than 10 minutes. Patients have minimal bruising postoperatively. With Ziplyft, we will be opening eyes beautifully. Thank you for your attention.